So how often are you using proning on non-intubated patients? Is that something that you're doing to most of the patients who are on either high flow or non-invasive? And what type of schedule are you using to alternate between prone and supine?
So we do encourage patients who are in high flow and on non-rebreather to soft prone if they can. If it's been shown that to improve oxygenation, I don't think it's been proven that it decreases mortality, morbidity, or even
Correct. Yep.
progression to disease. Right? Some of these patients, despite proning and increasing their oxygen saturation, they will still progress to needing invasive ventilation. So, I tell them is, most of my patients tell us just, do as much prone as you feel comfortable, but usually at least minimum of 3 hours at a time. But there's patients that can be, they feel comfortable proning for the whole day and they just move to their side just to eat and whatnot, right? Now, proning is awake proning sounds, easier you think, but it's not, right? A lot of older patients have a lot of difficulty, understanding and doing it. Obese patients have a terrible time also self-proning is very uncomfortable. So those who cannot self-prone, we just tell them, try to then lay in your side, right? Side to side, alternating a few hours, and that might be helpful too. So again, it does help with oxygenation. I don't think it prevents intubation at all. And that's for awake proning, right? If they get intubated, so usually, we do proning, which also we know help decrease mortality in RDS. With that, usually we do, the recommendation somewhere between 12 to 16 hours of proning. Here at NYU, we usually do about 16 hours at a time. And we have seen that patients do, those who respond to proning, they do, and you should see a response to proning within hours, right? The first 1 to 2 hours you should see a good response. Some patients might take a little bit longer, 12 hours, maybe 24. Past that, if you don't see a response with proning, then you have to think about what else can you offer these patients.
And are you using the same rules basically for your intubated patients?
For proning? Yeah, I haven't changed because of COVID. We haven't changed our proning protocols. We using the same proning protocol that we used before for ARDS, for whatever reason it was. Whatever the detail of the RDS was, we still use the same, which is, like I said, 16 hours minimum. The only thing that changed is that we usually used to use a broader prone bed, and we have noticed that a lot of these COVID patients get a lot of skin, injuries with those beds. So we're doing more manual proning for those patients.